Welcome to the deep dive. Today we're going to be checking out this platform called Exelare. It's using AI to, kind of change the game for how doctors are recruited.
Yeah, it's a pretty cool space, like where healthcare is really running into, like the latest tech. And AI could make a huge difference here.
For sure. And we actually have a demo of Exelare to watch. You ready to see how this thing takes on some of the biggest recruiting issues?
Absolutely. I've heard some pretty good things about it.
Okay, so the demo starts with Exelare's AI search. And honestly, it's kind of like having a genie, but for recruiting. Imagine like instantly going through thousands of doctor profiles, filtered by specialty, experience, location, you name it.
Yeah, that speed and being so precise, it could totally change the game, especially for recruiters, right? They're so used to spending hours, like, manually going through resumes and databases.
Oh, totally. And the demo even shows you how to find like really specific people, like say a cardiothoracic surgeon in Chicago who specializes in minimally invasive procedures.
And the cool thing is, you don't have to be some kind of tech genius to use it. They show you in the demo how Exelare's AI actually helps you build those search criteria, even if you've never heard of like Boolean search or whatever.
Yeah, that's smart. Makes it easy for pretty much anyone to use. Not every recruiter is a tech expert, right?
Exactly. The easier a tool is to use, the more people are going to actually use it, and then it can, actually make a difference.
Right. Okay, so we found some potential people. Now what? Well, that's where Exelare's centralized candidate profiles come in. It's basically like having this super organized digital file for every doctor, keeping everything all in one place.
No more juggling spreadsheets or a million emails. The demo shows how you can keep CVs, certifications, all the communication notes, everything right there in each doctor's profile.
Like a one-stop shop for all your candidate stuff.
Yeah.
Yeah, I can see how that would be huge for staying organized and keeping everything accessible.
Oh, yeah, definitely. And not just for like one recruiter, but for a whole team. Everyone can see the same info, which can really help streamline communication and make working together easier.
And speaking of streamlining, let's talk about those doctors who aren't actively looking for new jobs. Exelare's got a pretty neat way of connecting with these, what they call passive candidates.
Right. They've got this automated outreach and personalized messaging thing. You can set up campaigns that target certain groups of doctors, like those cardiothoracic surgeons we were just talking about. And the AI can even create whole series of emails and even text messages.
Yeah, the demo really makes it clear that you can personalize these messages, schedule them ahead of time, even track how they're performing. It's like having your own mini marketing team, just for building relationships with possible candidates.
And it's not like just sending out some generic mass email to everyone. They show in the demo how you can really tailor the messages based on a doctor's experience, their location, even like their career goals.
So like a doctor with 10 years of experience in academic medicine might get a different message than someone who's been in private practice their whole career.
Exactly. It's all about making it feel more relevant, more engaging, so that doctors are more likely to actually open that email and like think about the opportunity.
Makes them feel like the organization really gets them, like they've actually taken the time to understand their specific background and what they're interested in.
Totally. It's that personal touch, which can be missing in a process that often feels pretty impersonal.
For sure. Now, about the actual placement process, Exelare handles this with what they call a visual candidate pipeline. Basically, it's a visual way to see where everyone is in the hiring process.
Yeah, in the demo, they show how recruiters can literally drag and drop candidates through different stages, like potential, submitted, interview, all the way to like placed or rejected. Really intuitive way to get a sense of the whole process.
And they highlight how each of those stages can trigger these automated actions, like sending emails or scheduling interviews. Think of how much time you could save.
Right. It could free up recruiters to, focus on the bigger picture stuff, like building those relationships, figuring out if someone's a good cultural fit, really getting to know the candidates.
Absolutely. And then there's this feature for taking detailed notes at each stage, too. So you've got a smooth and well-documented process.
Yeah, that kind of documentation is really important, especially in healthcare where things have to be, accurate and by the book.
So far, we've seen how Exelare uses AI to streamline this whole doctor recruiting journey. But seeing features in a demo is one thing. Seeing them work in the real world is another.
Totally. Let's look at some real-world examples of like how healthcare organizations are actually using Exelare to, get actual results. Okay, so let's dive into some case studies then. One that really stood out to me was this hospital system in the Midwest. They were really having a tough time filling, those specialized nursing positions, just really struggling to find qualified people.
Yeah, I feel like that's a pretty common problem these days. I mean, healthcare is facing a huge shortage of qualified professionals.
Totally. And so this hospital, they were relying on those, more traditional ways of recruiting like job boards, agencies, that kind of thing. But they just weren't getting the results they needed, so they decided to try out Exelare.
Okay, so how did they actually use the platform?
Well, they started with that AI-powered search we were talking about. They were looking specifically for nurses with experience in like critical care and emergency medicine. And the AI was able to pretty quickly pinpoint potential candidates from this like massive tool of profiles.
So instead of just like passively waiting for people to apply, they were able to go out and find qualified nurses. Nurses who, might not even be actively looking for a new job.
Exactly. And that's where the personalized outreach that we talked about comes in. They used Exelare to create these really targeted campaigns for these nurses, highlighting, the hospital's values, their culture, and the kinds of unique opportunities they could offer.
I bet that kind of personal touch makes a big difference. It shows them that the hospital's really interested in them and their skills.
Right. And the results, they really speak for themselves. The hospital, they saw a big increase in, the number of qualified people applying. And they were able to fill a bunch of those hard to fill nursing positions, like within a few months of, starting to use Exelare.
Wow, that's a pretty impressive turnaround. Sounds like Exelare helped them tap into a whole talent pool they might not have even known about before.
Oh, for sure. And it wasn't just about finding more candidates. It was about finding the right candidates, right? They were able to connect with nurses who were not just qualified, but also a good fit for, the hospital's culture and their values.
Makes sense. Okay, let's switch gears a little bit and talk about another case study. This one is about a large physician group, and they were basically trying to like revamp their whole recruiting process. They were spending way too much time and money on, administrative stuff like screening resumes and scheduling interviews.
Yeah, sounds like they were totally bogged down with paperwork and logistics, which, I mean, that's a pretty common problem for recruiting teams.
Oh yeah, definitely. So how did Exelare help them out?
Well, they decided to implement that visual candidate pipeline, the one we were talking about,
Mm.
and those automated features.
Yeah.
And it really made a difference.
So instead of manually tracking all those candidates through like spreadsheets and emails, they could see everything visually, right?
Yeah.
Which makes managing the whole process way easier.
Right. They could see each candidate's progress, where they were in the pipeline. They could get a clear overview of like the whole recruitment workflow.
And those automated actions probably save them a ton of time too, right? No more like manually sending out emails or setting up interview times.
Exactly. And because Exelare lets you take detailed notes at each stage, the physician group could communicate and collaborate better as a team. Everyone was on the same page, and they could easily share feedback and insights about each candidate.
It sounds like Exelare really helped them create a more efficient, organized and transparent recruiting process.
For sure. They were able to free up their recruiters to focus on, the more important stuff, like building relationships, assessing that cultural fit, and really like getting to know each candidate on a deeper level.
So both of these case studies really show how Exelare can be a game changer for healthcare organizations that are, struggling to find doctors. But what about the bigger picture? Like how might AI-powered platforms like this, how might they shape the future of healthcare staffing?
Oh, that's a great question. That's something we definitely need to explore.
Yeah, it really feels like things are changing in a big way in the world of healthcare recruiting. We've seen how Exelare can like fix those urgent problems. But what about the long term? What could happen down the road?
But that's where it gets really interesting. Like, imagine if AI was handling all that, really time-consuming stuff.
Yeah.
Then recruiters could actually focus on the human part of the process.
Yeah.
They could spend more time building those relationships, really understanding what the healthcare organizations and the doctors both actually need, and then like making matches that really work for everyone.
So it's not just about filling those empty positions as fast as possible. It's about like finding that right fit for everyone.
Exactly. And I think that could actually have like a ripple effect through the whole healthcare system. If doctors are, happier where they are, they're more likely to give better care to their patients. It's a win-win.
Mm. Yeah, that's a really good point. And it makes you wonder what other cool stuff we might see in the next few years, right? Like, could AI actually predict, future staffing needs? Could it find up-and-coming talent? Could it even help doctors figure out their career paths?
I mean, all of that's possible. Honestly, we're just getting started with what AI can do for healthcare recruiting. And as the technology gets better, we're definitely going to see even more creative and, impactful solutions popping up.
It's pretty exciting to think about how this could affect patient care. If we can make it easier to connect those really talented healthcare people with the places that need them the most, then everyone benefits.
Absolutely. And that's something to think about as you keep learning about this stuff. How could these advancements actually change how healthcare staffing works, and how could it change the patient experience?
Yeah, those are some great questions. Well, thanks for joining us for this deep dive into Exelare and the future of physician recruiting. Until next time, keep on diving deeper.